The House will come to order. Calendar for the day. The first bill on the calendar for today is House File 1036. The clerk will report the bill.
House File number 1036, number 2 on the calendar for the day, an act relating to health care.
The member from Candy, Ojai, Representative Backer, to your bill.
Actually, Mr. Speaker, that would be Baker and not Backer. For clarification, I want to clear that up one more time. Thank you, Mr. Speaker. Members, I bring forward today House File 1036, which is a housekeeping bill brought to me by the Minnesota Academy of Physician Assistants. I want to thank the bipartisan authors that joined me in introducing this bill, and I believe it should have no controversy. It's a good bill to bring our physician assistants, otherwise I'll be referring to them today as the PAs, to enhance the policy so they can actually do a better job performing their duties. PAs are a growing part of our healthcare delivery system today. Augsburg College used to be the only PA training program in Minnesota, but it has been joined recently by the St. Catherine's University and Bethel University. And soon a 4th PA training program will be coming online at Duluth at the College of St. Scholastica. After introducing this bill, I've heard from some of you that your family doctor is actually a PA, especially when it comes to rural Minnesota. I want members to know that before I go any further that the bill makes no changes to the scope of what a physician assistant can do. I don't believe there's, again, any controversy to this bill. I have not received any word from anyone or any groups, organizations. It has been reviewed by the Board of Medical Practice, which licenses and regulates the PAs, and the board has no concerns with this bill. The bill makes several changes to the existing statutes, and I'll go through just a few of them today, all of them today actually, 1, 3, and 6. PAs do not have the independent practice to authority on their own. They must have a written agreement with a supervising physician that outlines the scope of what they can practice. The bill does not change that. Minnesota PAs believe the collaborative partnership between the PA and their supervising physician works very well today. However, current law requires a PA to also have an alternative supervising license agreement with another physician with a second physician in case their primary physician is unavailable. This agreement is identical to the primary supervising agreement, which is believed to have been required in cases when the supervising physician was absent or on vacation. This requirement is believed to have been enacted back in the 70s, and when many physicians and physician assistants practiced in small 1 and 2, 3 physician clinics, it was relevant to that day. That is not how PAs are practicing today. Today, much of the outpatient care is delivered in large multi-specialty cares and clinics that may have dozens or even hundreds of physicians. Similarly, PAs practicing in hospitals or surgical suites may work with different physicians in their course of their shift. So requiring them to have secondary license is very inefficient and not required. The physician assistant, this part of the bill eliminates a secondary form, and I think, again, this is all approved by the boards, and I think this is a good thing. They do not have to have the encumbrance of extra paperwork from other docs, because the PA will always be working with their primary doctor and that agreement and the scope of their ability to practice. So eliminating the alternative supervising physician requirement will maintain that existing physician agreement, but the PA won't have to spend time getting signatures from multiple doctors. In Section 2 of the bill, members, this eliminates another outdated supervision requirement. Currently, a practicing physician can have a maximum of 5 PAs underneath his or her license. Today, again, as rural Minnesota needs more docs and PAs in rural Minnesota, and as the clinics have gotten larger and the hospitals have gotten larger, the limit of 5 is not a good thing for us, and we believe that that number 5 should be removed, and we not have a limit on the physician assistants that are being practicing in Minnesota. So the PAs will still have that practicing physician to report to, and the physician, if they want to take more than 5 or 6 or 10, that physician, the primary physician, has the ability to do more than 5. However, they still have the complete liability, so that would eliminate most doctors from not taking on more than they can handle. So again, the boards have said this is a good opening to allowing more opportunity out there for rural doctors, and this is also, again, supported by the medical doctors. Other states are doing this. South Dakota, North Dakota have eliminated the cap as well. Section 4 of the bill modifies the reporting requirements for the PAs. Currently, a physician assistant cannot begin practicing after they have been licensed and have been hired by a hospital or clinic until they notify the Board of Medical Practice where they will be practicing and the name of the supervising physician. As you transfer and get into a new opportunity of employment, these PAs are getting used to their doctors. They were not able to practice prescribing any medications until they were actually hired and have all their ducks in a row, if you would. But this change in this part of the provision of the law allows that practicing, or the physician assistant, to give 30 days notice to the Board of Medical Practice to track the prescribing offerings. The board maintains a database for those PAs so they know with the prescription monitoring program where all these doctors are, the PAs are, and how they're prescribing their medications, where they're prescribing it. But they're giving them a 30-day window now to sign up with the board. And members, that's the highlights of this bill. Again, it just clarifies language to make sure that we are current and supportive of the necessary role that our physician assistants are carrying throughout all of Minnesota, and again, especially the needs of their demands for medical care in rural Minnesota. So members and Speaker, I stand for further questions. Thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 1036.
Third reading. The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, I support the bill in general. There are many good pieces of the bill. I do want to start by saying that I think that Minnesota is very fortunate to have an excellent medical community, including our physician assistant community. They do a lot of very good and important work. And most of this bill, I think, is great, you know, removing some of these, what really would amount to just bureaucratic requirements is a great thing. There is one part of the bill, though, that I do have some concern with, and that is removing the cap on the number of PAs that can be supervised by one physician. I have had some discussions about this with various interested parties, but I just want members to know what's going on here. And I will be supporting the bill because there are good pieces in it, but I do want members to understand that we're going from a limit of 5 PAs that can be supervised by one physician to a limit of infinity. And I know that most physicians are going to be responsible, but there is no definition of what it really means to supervise a PA. And that does give me a little concern. I would have preferred that there would have been a little finer distinction here. In other words, that we would have changed the rule with a scalpel rather than a hatchet. What we're doing here is using a hatchet. I know there are many situations in which a physician can absolutely safely supervise more than 5. But in the bill, already in current law, there are exceptions so that the Board of Medical Practice could give an exception already in those situations. As members may know, physician assistants do a wide variety of practice. So it is true that one size probably should not fit all in this area. But I do have concern about just taking away the limit. Period. I do think that goes too far. Representative Baker, and I wish that we were doing something a little bit more subtle rather than that. Representative Baker mentioned that South Dakota and North Dakota have eliminated this cap, and I'd like to ask him if he would yield, Mr. Speaker.
Representative Liebling, he will yield.
Thank you, Mr. Speaker. And Representative Baker, I wonder if you have any other information about other states, because usually we don't look to, at least I don't, usually look to South Dakota and North Dakota as big leaders in health care. Rather, other states look to Minnesota. And the quality of care here in Minnesota is really, I would say, second to none. And so I just wonder what the trend is in other states around this issue, just the issue of eliminating the cap on the number of people of PAs that can be supervised by one physician.
Representative Baker.
Thank you, Mr. Speaker, and thank you, Representative Liebling, for your support of this bill as well. Specifically to your question, I do not have the information about how many states have it. I just know that a variety of other states, again, I can't tell you if that's 5 or 25. I'm sorry. If you want, I would be happy to get you that information. I know that the 2 states that I had mentioned earlier are in that zone that we're looking towards to match up with, but as of today, I will be happy to get that information for you real soon. Thank you.
Representative Liebling.
Thank you, Mr. Speaker. Well, members, I'm not going to recommend a no vote on the bill. I think as I said, it's kind of a mixed bag here, but I think we're not going to probably see the end of this issue, because we're treating this with a very broad brush, and I think that goes a little bit too far. So I hope that we can kind of track this and monitor it and see how this works in practice. And we are definitely counting on the expertise and professionalism of our physicians, and I think that's usually a very safe thing to do in this state. I think we have an excellent physician community, but you know, often we pass laws that are trying to really kind of look out for the outliers, and I certainly hope that in this case there won't be any, and that supervision will continue to mean something in this state. That's really my concern. PAs do a lot of very important work. They really act very much like physicians. There's really very little difference except that they are under supervision. And I want to make sure that rural Minnesota has the same quality of care, and that we maintain that quality of care as a person could get anywhere in the state. So thank you, Mr. Speaker.
The member from Ramsey, Representative Mahoney.
Thank you, Mr. Speaker. And would Representative Backer yield for a question?
I do not believe he's going to yield this morning, Representative Mahoney. The member from Washington, Representative Ward.
Thank you, Mr. Speaker. Representative Baker. Baker. We'll get this straight. You guys are so much like... I did a little research, and I want to support what Representative Liebling suggested. California limits physician's assistants to 4 per physician. The American Academy of Physicians Assistants recommends a strategic approach, depending on the specialty, depending on the practice, depending on the population that is being served, whether it's immigrants or homeless shelters or rural communities. So I thought that Representative Liebling's suggestion of using a scalpel instead of a hatchet was very appropriate for what they are recommending, and that we spend a little bit more time. I also am not going to vote against this bill, but I'm hoping that we can work on it a little bit more to be more strategic and specific in being sure that we're covering the bases and being appropriate. Thanks very much.
Any further discussion? Seeing none, the clerk will take the roll. Members, please vote. Members, please vote. The clerk will close the roll. There being 129 ayes and 0 nays, the bill is passed and its title agreed to.
The next bill for consideration is Senate File 1265. The clerk will report the bill.
Senate File number 1265, number 6 on the calendar for the day, an act relating to insurance.
I recognize the author of the bill from Fillmore, Representative Davids.
Thank you, Mr. Speaker and members. If I could move the DEA 1268 amendment to put the House language in, please.
There is an amendment. The clerk will report the amendment.
Davids moves to amend Senate File number 1265, the first engrossment as follows. Delete everything after the enacting clause and insert the following language of House File number 1268, the first engrossment. And the amendment is coded DEA 1268.
Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker and members. Well, House, now that we have the language inserted, it's the Senate File 1265. What we have here is a bill having to do with insurance agents being able to submit agent of record letters to the insurance carriers. I'm talking about health insurance here. So it has to do with the carriers, plus it also has to do with agents that are writing MNsure plans. Members, what we've had in the past year or so on MNsure, we've had agents are not getting their names on as agent of record even though they're doing the work. This would just make it easier for that to happen. We've had a lot of insurance agents the second year into MNsure dropping and not helping consumers. So basically, members, this just simply, in that regard, makes it so agents can get on as agent of records. It's supported by the agents associations.
Member from Dakota.
Members, we're working with the carriers this is different. It'll be different than what the Senate did. So there would be a conference committee, and there's a few questions yet that we'd like to get worked out.
Member from Dakota, Representative Atkins.
Thank you, Mr. Speaker. Thank you, Representative David, or Chairman Davids, for bringing this bill forward. It makes sense. Whether you, I know anytime the word MNsure gets uttered, makes people a little skittish. Whether you are pro-health insurance side or whether you're pro-consumer, this makes sense for both sides. It gets consumers the sort of good advice that they get from agents, and it makes sense for the agents as well. So I'd ask for a green vote.
Seeing no further discussion, all those in favor of the amendment, please signify by saying aye. Opposed, say nay. The motion prevails. The amendment is adopted. There's another amendment at the desk. The clerk will report the amendment.
Davids moves to amend Senate File number 1265 as amended, and the amendment is coded A1.
Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker. Members, this basically, the way the bill was originally written, you could go back 18 months to have an agent of record letter. This says that you can go back to the first of the year. This is one that will be for further discussion in conference room, but I think going back 18 months is a little too far back, so I'd appreciate support on the amendment.
Seeing no further discussion, all those in favor of the amendment, please signify by saying aye. Opposed, say nay. The motion prevails. There are no further amendments at the desk. The clerk will give a bill its third reading.
Third reading, Senate File number 1265 as amended.
Third reading. Discussion to the bill. Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker. Members, I'd appreciate your support.
Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. I'm sorry to speak after the author here, but I wonder if Representative Davids would yield to a question.
He will. Representative Liebling.
Thank you, Mr. Speaker. Representative Davids, does this bill require any kind of reprogramming on the part of MNsure? Do they have to make any modifications to their IT system to get this to work?
Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker and Representative Liebling. It really shouldn't, because the way it's set up now, they're supposed to be able to put agents of record onto the consumer's policies. This just allows it basically, it makes it a lot easier if an agent hasn't been put on and should have been put on to get on there. So I wouldn't say with 100%, but I can't believe it would take any more IT when they're already supposed to be doing this.
Member from Olmsted, Representative Liebling.
Well, thank you, Mr. Speaker, and thank you, Representative Davids, if he would yield for another question, Mr. Speaker.
He will. Representative Liebling.
Thank you, Mr. Speaker. Representative Davids, I wonder then, was there any kind of fiscal note on this so that we could be assured, if there's even a possibility that there would be a programming cost to this, I would think that there would be a request for a fiscal note on this. I wonder, did you request a fiscal note, and if you did, what did it say?
Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker and Representative Liebling. There is no fiscal note, and MNsure was in the hearings and did not bring anything up that there'd be any added cost to this, so we should be good.
Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker, and if he would yield one more time, Mr.
He will.
Speaker.
Representative Liebling.
Thank you, Mr. Speaker. Representative Davids, that brings to my mind the question of did the MNsure staff support the bill?
Member from Fillmore, Representative Davids.
Thank you, Mr. Speaker. Representative Liebling, they took no position.
Representative Liebling.
Okay, thank you, Mr. Speaker.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. There being 128 ayes and 0 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day. The member from Hennepin, Representative Clark, for what purpose do you rise?
Thank you, Mr. Speaker and members. I rise today to recognize the annual celebration of Nurses Week. Before I was elected to this body, I worked both as a public health nurse and an OBGYN nurse practitioners, and many of us here have family and friends who are nurses, and so we want to make sure that we honor the contributions made by more than 116,000 nurses that are licensed in our state. Some of them are here with us today up in the gallery. And to honor the legacy of those other remarkable professionals who have gone before them. Nurses Week begins today, and it ends on May 12th, which is the birthday of modern nursing's pioneer, Florence Nightingale. And I just want to tell you, in my nursing history, I learned that Florence Nightingale was a pretty uppity nurse. During the Crimean War, she went around and opened up all the windows to let in the fresh air, and that was against the rules, but she didn't always follow the rules, and I think some of us nurses feel good about that. Then, as now, nurses care, not only as individuals, but as, of course, for whole communities. And we stand, and I am very proud to stand in support and solidarity with my fellow nurses. The Gallup Honest and Ethic polls say that we are some of the most trusted professionals in America for the last 16 years running. Nurses care with dedication, courage, and are very hard workers, and work under some of the most stress-filled circumstances one can imagine. I just want to share with you that many nurses are injured in their duties. In fact, nurses are 3 more times more likely to apply for workers' compensation than construction workers or peace officers. So this Nurses Week is an opportunity to shine a light on this noble profession, and with that in mind, I want to read from the official House resolution before I yield to my fellow nurse, Representative Hertas. So, a House resolution proclaiming May 6 to 12, 2015 as Nurses Week, and you all have this on your desk. Whereas the state of Minnesota places the highest priority on quality health care for all of our citizens and greatly appreciates the 116,685 dedicated and professional licensed nurses in the state. And whereas the Minnesota Nurses Association effectively pursues its mission to promote the professional, economic, and personal well-being of nurses, uphold and advance excellence, integrity, and autonomy in the practice of nursing, and advocates for quality care that is accessible and affordable for patients and consumers. And I yield to Representative Jerry Hertas.
The member from Hennepin, Representative Hertas.
Well, thank you, members and Representative Clark. Members, in the clinical setting, it's important to understand that the nursing profession and nurses really are the eyes and ears of the primary attending physician, and their observations are critical to developing an effective patient care plan. And with that, from the resolution, I would like to add, whereas the depth and breadth of registered...
Representative Hertas, if you could just suspend for a second, I'm sorry. Members, the noise in the chamber has become quite loud. Please take your conversations to the alcoves or to the retiring room so the members may hear the debate in the speeches. Representative Hertas.
Thank you, Mr. Speaker. Whereas the depth and breadth of the registered nursing profession meets the different and emerging healthcare needs of the American population in a wide range of settings, including medical centers, local hospitals, outpatient clinics, psychiatric centers, nursing homes, veterans homes, addiction treatment centers, correctional facilities, medical rehab facilities, homes for the developmentally disabled, adolescent residential and secure facilities, community facilities, schools, private offices, family homes, and public health services. And whereas the cost-effective and high-quality healthcare services provided by registered nurses will be an even more important component of Minnesota's healthcare delivery system. And with that, Mr. Speaker, I would like to yield to Representative Aaron Murphy.
Member from Ramsey, Representative Murphy.
Thank you, Mr. Speaker and members. You have the resolution before you, and I'm not going to read my section of the resolution, and instead say that I, along with my nursing colleagues, have been with Minnesotans when they're born. It's a glorious experience to see somebody born. We're there when they receive bad news and sometimes good news, and we walk them through that with their families. And often, and I have been with someone when they died, sometimes quietly and sometimes violently, but died nonetheless. And we're there to do our job at that point. I have been in a room when a ureter has been connected to a kidney, and the kidney makes urine. It's so cool. It is such a cool thing to see that version of life renewed when there's a kidney transplanted. And I've been also in a room when a 16-year-old has been declared brain dead and his organs harvested at the very start of his young life, only to see those organs go to start a new life for somebody who's in desperate need. All of that is to say that nurses are our neighbors. They are our family members. They live in all corners of the state of Minnesota, I know, because I have been with them all over the state of Minnesota. And they are doing the quiet and important work of caring for us and our families every day, and they do it as often unsung heroes. And let me just say, because I see some of my sisters in the gallery, that we are a tough bunch because what we face in our day-to-day work, real life situations, the hard, the good, the unfortunate, and it certainly does make us tough fighters for the people of Minnesota. That's one of the reasons why I'm here. And with that, I'll yield the floor again to Representative Karen Clark.
Member from Hennepin, Representative Clark.
Thank you, Mr. Speaker. And with all of that, I will just say the resolution says, be it resolved by the Committee on Rules and Legislative Administration of the House of Representatives of the State of Minnesota that it hereby proclaims May 6 to 12, 2015 as Nurses Week and ask that all residents of the state join in honoring the registered nurses who care for all of us. Be it further resolved that the residents of the state of Minnesota celebrate registered nurses' accomplishments and efforts to deliver quality patient care and show our appreciation for the state's registered nurses, not just during this week, but at every opportunity throughout the year. And this is dated May 5th, 2015, and signed by Speaker Kurt Doubt, Chair Joyce Pepin, and myself, State Representative Karen Clark. I thank you, Mr. Chairman and members. And maybe we could show our appreciation to the nurses who are here today with a round of applause.
The next bill on the calendar for the day is House File 1427. The clerk will report the bill.
House File number 1427, number 8 on the calendar for the day, an act relating to local governments.
I recognize the author, Representative Daniels from Rice, who will explain the bill. Representative Daniels.
Thank you, Mr. Speaker. This is a really relatively simple bill. It just changed some language with how often the board needs to meet. I was going to explain a little bit about it. District 1 Hospital is my local hospital, and they joined the Atlanta Health Systems in 2014. A few months ago, I was approached by the president of the hospital, Mr. Stephen Pribble, came to me with the issue about the frequency that the board meets. Mr. Pribble said the merger with Atlanta has gone extremely well. You'll see a letter that I passed out here that explains from the chair how well that merger has gone. And basically, he said we don't need to meet in a month. Everything's going so smoothly. So they wanted that language changed. I didn't see any problem with that. So the language would be changed to they need to meet at least 2 times a year, or they can call a board meeting by either the chair or 2 of its members. So there's really nothing changed other than the amount of board meetings they have per year. I talked to Atlanta Health System. They are just fine with the change and ask for support.
There are no further amendments to the desk. The clerk will give a bill its third reading.
Third reading, House File number 1429.
Third reading. Discussion to the bill. Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Would Representative Daniels yield to a question?
He will. Representative Liebling.
Thank you, Mr. Speaker. Representative Daniels, I'm a little confused by the letter that you passed out here, which seems to be requesting something different than what your bill is doing. Can you explain this to us, please? Because they say that they want legislation allowing them to meet not less than once per year. Because, and I just had a quick reading of this, but I think they were saying that current law already allowed them to meet twice a year. Could you just reconcile this with what you're doing in the bill, please?
Member from Rice, Representative Daniels.
Thank you, Mr. Speaker. Thank you, Representative Liebling. The language right now, according to Section 4, says they have to meet every month. And when they go to their meetings currently, it's a very, very short meeting because there's really nothing new to go over. So the language used to be they were told they had to meet every month. They're just simply asking not to have to meet every month. They could if they needed to, but they're just asking for the freedom of not having to meet every month unless they have something to actually talk about.
Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. Well, Representative Daniels, I understood that part, that they don't want to have to meet every month, but the letter in front of us says that they passed a resolution. Okay, it's like the second to the last paragraph, and it says they want to change the frequency language to say the district board will meet on a regular basis not less than once per year. The motion was approved, but that's not what you're doing in the bill. You're saying they have to meet twice a year, right? So it's a little different than what they're asking for, or is there a little, what's the disconnect here?
He will yield. The member from Rice, Representative Daniels.
Thank you, Mr. Speaker. Thank you, Representative Liebling. My understanding is if they say they have to meet more than once, that would be twice as a minimum, because more than one would be 2. But basically what they told me is they just need about 2 meetings per year to take care of their business, but they certainly don't need 12 meetings per year.
Member from Olmsted, Representative Liebling.
Well, Mr. Speaker and members, I still think there's a little conflict going on here because they passed a resolution saying they want to meet not less than once. And I guess what Representative Daniels is bringing here is something that says they have to meet at least twice. So, I mean, I don't object to the bill, but I don't know, there's something here that I'm not quite getting still. So maybe the rest of the debate will explain it to me. Thank you, Mr. Speaker.
Member from Cottonwood, Representative Hamilton.
Well, thank you, Mr. Speaker. And I'm holding the letter here, and the way I read it, the letter states that they're asking for no less than twice every year. And then I have a copy of the bill, 1427, and it reads to be held at least twice every year. So I think it's accomplishing exactly what the author has intended. Thank you, Mr. Speaker.
Seeing no further discussion, the clerk will take the roll. Members, please vote. The clerk will close the roll. There being 128 ayes and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is Senate File 1120. The clerk will report the bill.
Senate File number 1120, number 5 on the calendar for the day, an act relating to public safety.
I recognize the author of the bill from Blue Earth, Representative Cornish, to explain the bill.
Mr. Speaker and members, this bill, Senate File 1120, is co-authored or authored in the Senate by Senator Sharon. It's already passed and is over here now. I've instituted or substituted the Senate file for the House language. This is a bill I've been working on for probably 2 years at least. It started out, the impetus behind the bill was the assaults that were taking place at the St. Peter the hospital for the mentally ill and dangerous wing, where the assaults were occurring at a high rate, numerous assaults per week, sending care workers, their direct care workers, to the emergency room. We tried to find some way to mediate it, working with management and labor. This is just a bite of the apple at some current things that are going. Just keep in mind that this bill enhances the penalty. These people can already be charged with a crime, but we've heard from the county attorneys that it's hardly worth messing with at the low level that they had it. This allows them to be charged with a felony. The changes that were made in the Senate were they took away the minimum mandatories and gives the judge the a freedom to sentence as he or her wants to in the trial. And it also defined assault, and it under the throwing of feces, bodily fluids, or urine, it restricted it to that and took out saliva. And excuse me, the county attorney has told me that this still allows the judge the freedom to, like I had said, and it doesn't change anything on the competency trial or competency to stand trial. They still has a right to go before a court and see if they're competent to stand trial for this charge, and gives the prosecutor discretion. There's nothing mandatory about having to charge. And this separates a volitional conduct from conduct that comes from being mentally ill. Some of these attacks are planned out, written out, diagrammed out, and methodically carried through, and shows a clear intent. And we need this to, like I say, just one more step in putting a deterrent in keeping these direct care workers from being assaulted. And some serious assaults. Already a number of people in these institutions have been permanently disabled by the assaults, and I've gone to a couple of the fundraisers for them to bring them back to work. Currently, they do not carry restraints or mace or anything at all to protect them except pads that they hold on their arms, and have to hang on to the pads, the handles, to keep from being assaulted. That's the only defense they have until help arrives. And the patients know that, some of them, and plan out these attacks. And so this is an attempt to bring some common sense to allow them to be charged. And like I say, it still gives protection to the person's rights to go through a competency trial and discretion to the judge. So I would hope for your support and answer any questions that you would have.
There being no amendment to the desk, the clerk will give the bill its third reading.
Third reading, Senate File Number 1120.
Third reading. Discussion. The member from Blue Earth, Representative Considine.
Thank you, Mr. Speaker. I do rise to support the bill. I have a couple questions about deterrence with somebody that is actively hallucinating and attacking you. But it is a good bill for telling the workers that we do care about them and they have our attention. But let us be clear, this bill does not address the underlying problems. The Health and Human Services budget bill that we passed does not address the staffing and a lot of the other concerns that they have. I mean, if you really want to help these people out, you really need to follow Representative Johnson's lead. And with that, I will yield.
Member from Carlton, Representative Sundin.
Thank you, Mr. Speaker. Just wondering if the author would yield to a couple of questions.
He will. Representative Sundin.
Thank you. Representative Cornish, I've got some questions regarding probably some of the hidden costs of your bill. It could add to the prosecution rate that occurs in the counties, particularly Carleton County. I'm just wondering if you could reveal if there is any hidden costs that would be added on as far as the prosecution of these incarcerated people, transporting them back and forth from their facility to the courtroom, extra costs for the jailers in the counties, and court costs in general.
Member from Blue Earth, Representative Cornish.
Mr. Speaker, Representative, there was a fiscal note requested and it came back zero. And I think there was a specific mention that they didn't think very many people would be charged. This would be viewed as hopefully a deterrent and wouldn't change things that much, but the fiscal note said zero impact, and no local governments or the hospital has contacted me with any concerns about the local costs at all since the bill was introduced early in the session.
Member from Carleton, Representative Sundin.
Thank you, Mr. Speaker. And then if you'll yield for another question.
He will. Representative Sundin.
As far as public defenders' costs, is this going to add to the burden of public defenders in those counties?
Representative Cornish.
Mr. Speaker, Representative, I don't know. They haven't contacted me, and we shouldn't just assume as public defenders some of these clients are very wealthy and can pay for their own. So.
Representative Sundin.
Thank you, Mr. Speaker. I think one more question ought to do it.
He will yield. Representative Sundin.
Okay, Representative Cornish, I can see where this could actually clog up the court system a little bit more than it already is in a couple of these counties dealing with these prosecutions. I'm just wondering if increased staffing levels, proper staffing levels might be a more cost-effective way of going about this.
Member from Blue Earth, Representative Cornish.
Mr. Speaker and Representative Sundin, I haven't had any comments at all from the courts, public defenders, anybody in the judicial system about any cost, and nothing showed up in the fiscal notes. So as far as increasing funding for the judicial system, we're in conference committee right now. We'll see what happens.
Member from Carleton, Representative Sundin.
Thank you, Mr. Speaker, and thank you, Representative Cornish, for your answers. I do have a couple of fears with your measure. I'm just wondering if this is going to inhibit the prosecutor's ability to exercise their discretion in making plea deals here. I guess it could be regarded as a minor concern, but again, back to the staffing levels, I think it'd be far more cost-effective to staff these hospitals and facilities treatment centers, whatever, a little bit better rather than clogging up the court systems. So I'll be supporting your bill. I think this is a good first step. Thank you.
There being no further discussion, the clerk will take the roll. Oh, my apologies. Representative Johnson, my apologies. The clerk will not take the roll. Representative Johnson.
Thank you, Mr. Speaker. I guess I was a little slow to rise. I do stand in support of this bill, and I've spoken to the issue on the floor before, but I want to remind the members that when you work at the security hospital, the possibility of assaults is very much a part of your daily experience. As you leave your family behind, you go off to work, everybody in that household knows what the reality is. The kids know it, the wife knows it, the parents, the community knows it, and certainly the worker who's going to the security hospital knows that they're vulnerable to an attack. I agree with Representative Considine. This isn't the end all, and I think Representative Cornish recognized that as well when he said this is a bite at the apple. This is an important bite at the apple, in that it will provide some relief through the courts in some extreme circumstances. But I also take and therefore I strongly support this bill. We need to pass this bill. But I also want to remind my colleagues across the aisle that the shortcomings of the DHS bill in terms of funding, as was recognized on the floor in terms of funding, is also part of the solution. That we're understaffed in St. Peter, and we're understaffed in state-operated services, and that staffing needs to be done. So we need to take this bite of the apple today, but we need to consume the entire apple, or we need to take on the issue completely as we go through the process in the conference committees, and I hope that you can support that. So please support this bill. Let's vote yes.
Member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, I think we all agree here in the legislature that we have a very real problem at the security hospital. Nobody doubts that, and there is nobody here who doesn't really respect and appreciate the very tough work that our state employees are doing in that very difficult facility. However, I think that this bill goes completely the wrong direction in solving the problem. No doubt there are people at the security hospital who really shouldn't be there, who were misclassified, who were committed when perhaps they should have been found to be criminally responsible and they should be in other facilities. But there's a way to deal with that, and it's not the way that's before you, members. I want everybody to realize that in the Health and Human Services budget that the Republican majority passed not too long ago, there are $0 to help solve the problem at the security hospital. $0. So when members of the other body are passing this legislation, they're doing it in addition to putting forward money to solve the problem, to support the employees, to hire more employees, to actually help deal with the problem there. The solution that is being brought to this body is, I don't even know if it's a Band-Aid. I would venture to suspect that unless that it probably would do extremely little to actually solve the problem. And I have in front of me the pages from the budget that the governor proposed and that the Senate passed in their bill for the millions of dollars to hire additional staff, to comply with the Jensen settlement, which, for those who don't know, the state is under a court order to do certain things with regard to people with disabilities, and people in our security hospital are, by definition, mentally ill. They are mentally ill and dangerous, and they are qualified, they are considered disabled, and so we are under court orders to deal with them in a particular manner. And for the state to be able to do that and have our employees do it safely, we need additional resources in that area. You simply can't do it without that. And so to pass legislation that simply ups the penalties for certain behavior committed by people who are committed to that institution, I would say does little or nothing to solve the problem. And so I'm not going to support this bill. I think that criminalizing behavior by people who are mentally ill is absolutely ridiculous, and it actually goes opposite to the way that we're trying to move in this state, which is not criminalizing people who are mentally ill. We have all kinds of issues about moving people out of our jails who really don't belong there because they are mentally ill and not criminals. And in fact, there's a bill that came forward this year, I think Representative Hancock's bill, to have a new facility in Beltrami County to take the pressure off the jails for this very problem. And yet, what does this bill do? It really goes in the opposite direction. So let's not minimize the problem here, folks. We have a serious problem. We do owe it to our employees, our heroic employees who put themselves in harm's way, to deal with the problem, but we need to deal with it by allocating the funds to do that, not giving them to corporations as tax cuts instead. This is about priorities, and the Republican majority has expressed its priorities, and those priorities are tax cuts, not dealing with the security in our security hospital, not making our employees safe, but giving tax cuts instead, and using our surplus to do that. And that is wrong, and I am opposing this bill.
Member from Washington, Representative Dean.
Thank you, Mr. Speaker and members, and to Representative Considine. I know you don't serve on the Health and Human Services Committee, but if you did, and I suggest that you sign up for that in the future if you're fortunate enough to be reelected and you choose to do so. It's a great committee. We heard a lot of very compelling testimony around the facility, and if you remember, we funded we had within the governor's deficiency funding about $10 million in addition to the bonding money that we put forward for that facility. We've got a lot of controversy around how that money is being spent, not just at that facility, but at all our facilities. Anoka facility is another one where we're hearing a lot from the people who work there. And we don't always have the opportunity to respond to all of our email, particularly email outside of our district, but one of the ones that I did respond to was a worker at the St. Peter facility who was sharing with me some of his experiences in working at that facility. It's a very difficult place to work. The building itself is a hard place to work and manage. I know if you've been following the news, you know that there's been a murder at that facility where one patient beat another patient to death. We had another suicide and several injuries, both for folks who are working there as well as the clients who live there. It's a very dangerous place to work, and it can be a dangerous place to live as well. And what I heard back from the folks who actually live there was very different from what I was hearing in the testimony in our committee. And that is that there's so much overtime. Why do we have so much overtime while we have people that we have to hire here? Why is that? We can't defend ourselves anymore because we don't know what we can do and what we can't do, because what we could do last year to protect ourselves and to protect the clients is now we can't do that. I had a gentleman tell me he took an all-day course. It was $900, and it was how to defend yourself if objects are being thrown at you. And this is an advanced level course. And he said the first line of attack, the first line was to try to remove the object from the person who might throw it. The second phase of this was to try to block the object if you can't take it away from the person. And the third was to duck or maneuver around the object if it was in the air. Now, that's $900 of advanced training. He said, Matt, I don't know what they taught at basic, but that's what they taught at the advanced course. And these folks are really putting themselves in harm's way. Representative Cornish deals with these folks a lot. He hears from them, emails them. He started forwarding them the emails that we have. I've talked to Representative Mack about this, and we agree that we really need to hear more from the people who work there, not just from the union representatives or the department or the agencies, but we realize that we really do have a real problem with folks who work there not being able to protect themselves, folks there who, in one instance in committee, a man was beating his head against the wall and they didn't know how to intervene because they wouldn't know if they were breaking the rules that we currently have. The rules that we have today make it very, much harder to live in these facilities, very much harder to work in the facilities because they don't know the rules. And we also have staffing issues that we really have to get our hands around. So members, I really applaud the work that Representative Cornish has always done and continues to do, standing up for the folks who work in these facilities and also for the people who live there. Support your bill, Representative Cornish. Representative Considine, I encourage you to talk to me and encourage you to forward any emails that you might have or any folks who work in the facilities that might be in contact with you because of your experience. Would welcome that, and I know Representative Mack and I are going to be working in this in the time to come.
Without objection, we'll waive Rule 2.32, Order and Debate, and Representative Johnson.
Thank you, Mr. Speaker. I didn't mean to cut in line, but I just wanted to respond a little bit to the comments. And Representative Dean, I think you're explaining appropriately some of the complexity of working at the security hospital. But it has to be addressed, okay? It has to be addressed. And there's some of the problems you hear. Frankly, you know, I represent St. Peter. A lot of folks who work at the security hospital live in my district. I'm in ongoing conversation. I've visited the facility. I've spent time and saw responses. I'll start with the responses. I want you to know that the folks who are working at the hospital are remarkably professional in their approaches. Yes, they're frustrated by working with the rules, but the rules are ordered by courts. There's a legitimacy to those rules. The person-centered approach that they're using requires a lot of training. It's complex again, and they're working through this. And this is the point that I'm trying to make, is that progress has been made over the last year in response to the conditional license that occurred in late May of 2014, just a little less than a year ago. An important part of that conditional license was term number, I believe it's term number 9, I think I'm remembering the number correctly, which asked that there be a review of the rule governing the security hospital. This is something that Representative Cornish brought up on the floor a couple of years ago. It's something that's been considered and a lot of talk about, and that conditional license really gave an opportunity for this dialogue to begin and hopefully to continue. At the same time last summer, there was a OSHA violation. And those two processes dovetailed pretty well with each other that engaged the community that's involved with the security hospital in very deep and extended discussions. And again, I think it's fair to say that progress is being made. What's discouraging for me as a representative of these folks who are working there, of somebody who's been really watching the process, is that there's no funding for the conditional license moving forward into the next fiscal year. And that's where the hope lays, because there's this thorough process that does involve deeply the employees who are working there, does involve management, does involve interested parties. It's been a thorough discussion. It needs to play out. And so that's the point I'm trying to make, that we need to make sure that there's funding so we can support that conditional license, and that was in the governor's request, but not in the HHS Omnibus finance bill moving forward. But I think, setting that aside, I still stand in support of this bill. The folks who work there, the folks who are deeply involved with work there, they consider this an important step to help protect them moving forward. I don't think anybody is naive enough to say that this is the answer. No, it's not the answer, but it is a step in that, and therefore, again, I ask for a yes vote on the bill.
The member from Blue Earth, Representative Cornish.
Mr. Speaker and members, I'll make this real quick. I'm not going to address the finance issue. That'll be taken care of the jurisdiction of my committee. I'll do a real quick story, though. There are a number of workers watching the TV today to see how this goes. And one of this watching, and this is a true story, she's in bed right now taking pills. Her husband called the other day because she was too traumatized. She received a permanent disability from an attack at St. Peter. And her insurance was canceled. I tried intervening with MMB to try to solve the mess, and she's still canceled. And her husband was talking on the phone. I could hear her moaning in the background, and she said, "Please help me, Tony." And that was that's just a comment from the workers that are suffering these disabilities and attacks. So please vote green. Thank you.
Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. There being 121 ayes and 6 nays, the bill is passed and its title agreed to. The next bill on the calendar for today is House File 916. The clerk will report the bill.
House File number 916, number 3 on the calendar for the day, an act relating to counties.
I recognize the bill author, the member from Crow Wing, Representative Heintzeman, to explain your bill.
Thank you, Mr. Speaker. Members, this bill is a controversial but typically bipartisanly supported bill. Currently, 22 counties, or 75% of Minnesotans, live in a county that has moved to a system that appoints their auditor and treasurer. I'm asking that members would support this bill, a clean version of this bill, and I'd really appreciate a green vote.
There is an amendment at the desk. The clerk will report the amendment.
Quam moves to amend House File number 916, and the amendment is coded A15-0671.
The member from Olmsted, Representative Quam, to explain your amendment.
Thank you, Mr. Speaker and members, and those who have been around for a while. Normally, well, it used to be Tory would stand up about this point and speak, but he went to the Star Chamber, or some of us that have been on conference committee, the dark side, and is now in the Senate, honorably serving the people of his district. Basically, I personally don't have an issue with the reasons and justifications for going elective to appointive. There are good arguments, but I do believe there was a reason why these were elective positions to begin with, and that they should be accountable to the people, to the voters, the citizens of that jurisdiction. And this amendment is meant to allow that tie to the voters, to the people. It does nothing to prevent the appointment, does not interfere with who is selected, but does allow the people, with the same periodicity, to decide whether that person should stay there. I don't know if it would ever be used, but would, instead of having that position go from elective, accountable to the people, to appointive, accountable to the board, to still be accountable to the people and the citizens. And frankly, I think that's a good principle, because you cannot get more local than the voters and citizens of this state. And having said that, I will pull this amendment, but we always need to keep in mind when doing this change, it is not trivial. Thank you.
Representative Quam withdraws his amendment. There is another amendment at the desk. The clerk will report the amendment.
Nelson moves to amend House File number 916, and the amendment is coded A1.
The member from Hennepin, Representative Nelson, to explain your amendment.
Thank you, Mr. Speaker and members. And the amendment is similar to a bill I carried last year, and a bill we also heard in government operations this year, which basically allows all the counties to opt to do this, with provisions about referendum on it and all that. And currently, as was spoken here, Representative Heintzeman said, Currently, 33 counties now have the authority to appoint their county recorders. 32 now have the authority to appoint their county auditors. In fact, 70% of the citizens of the state of Minnesota already live in counties that do this. And Mr. Speaker, every year this is almost like a rite of spring. We have 1 or 2, 3 of these. I think the most, one year we had 5 of them. Counties came forward. So with this we'll have 34 and 32, or 34 and 33, excuse me. So I mean, it's, at what point do we get where we hit the critical mass where we allow all counties to do this? Is it when we get 86 counties or 85 counties and we let the last 2 do it? So man, that's what my amendment does, is basically allows all the counties through their boards to be able to do this with provisions for referendum and reverse referendum if they want to take them back. But Mr. Speaker, I know we don't have the votes to carry this, so I'm going to pull my amendment. I don't want to mess up Crow Wing County's ability to do this, but just to make the point that we do this every year, we pass it for 1 or 2 counties and then get the people to get up and oppose it and talk against it, but then we always pass it. So at some point we're going to get it to the point where we should just allow all the counties to do this and let the citizens, local citizens, decide to make that decision for themselves.
Representative Nelson withdraws the A1 amendment. There are no further amendments at the desk. The clerk will give the bill its 3rd reading.
Third reading, House File number 916.
3rd reading. Discussion on House File 916. The member from St. Louis, Representative Moline.
Thank you, Mr. Speaker. And will Representative Heintzeman yield for a question?
He will yield. Representative Moline.
Thank you, Mr. Speaker. And Representative Heintzeman, I'm looking at the Senate companion for your bill, Senate File 753, and it says the author of that bill is Senator Rude by request. Could you explain what the status of this is in the Senate and Senator Rude's position that she's the author of the bill by request?
Representative Heintzeman.
Thank you, Mr. Speaker. I honestly couldn't tell you exactly what Senator Rude's position is. I see that she is carrying it and the bill is moving.
Representative Moline.
Well, thank you, Mr. Speaker, and Representative Heintzeman and members. I mean, from my understanding, it usually authors would put by request when they are requested to carry a piece of legislation that they don't necessarily agree with, but they do agree to author it. And my concern is whether or not there's consensus among the voters of Crow Wing County that they want their ability to elect county officials taken away from them. You know, it is always a controversial topic, as you mentioned, but especially to see that the senator of Crow Wing County has authored this legislation by request only, indicating that she is possibly not in agreement with it. Mr. Speaker, will Representative Heintzeman yield for another question?
He will yield. Representative Moline.
Thank you, Mr. Speaker. And Representative Heintzeman, can you tell me how many county commissioners are there in Crow Wing County that will be making the decision on who the county auditor, county treasurer, and county recorder are, a decision that was previously determined by the voters?
Representative Heintzeman.
Thank you, Mr. Speaker. Over the last at least 4 years, I've been working quite closely with county government and working with my county commissioners on various issues, and this is something that has come up over the last few years. And we've been considering the cost benefit to this particular change in Crow Wing County. We've been looking at a number of factors, and so I would continue to urge members to support this amendment. This bill.
Representative Moline.
Okay, thank you, Mr. Speaker. My specific question was how many county commissioners there are in Crow Wing County, which I don't think I heard an answer to. Somebody behind me indicated it might be 5. And, you know, I just think members should be cautious in passing these kind of bills. I know that they have been bipartisan in the past, bipartisan support and bipartisan opposition, one of those unique circumstances. But, you know, right now, you know, I think that there's probably not an agreement with voters in Crow Wing County that they want 5 commissioners determining who these people are going to be as opposed to all the voters of that county. So I would just encourage members to proceed with caution. Thank you, Mr. Speaker.
The member from Aiken, Representative Lueck.
Thank you, Mr. Chair and members. I also represent Crow Wing County. Representative Heintzeman, the district takes in about 60% of the voters. I represent the other 40% of the voters in Crow Wing County. a very robust delegation of elected and appointed officials met with us both down here in St. Paul and back in the district. This is something that the county is simply asking permission to go through the process to make a determination at the local level as to whether or not they'll be able to hire and then, as state law requires, appoint these people to various positions. So I would urge a green vote. This is an example of a county that's been very efficient, held their local county tax revenue steady, not raised it, held property taxes down because they're working on efficiency. So I say, if you're a supporter of efficient local government, local control, this I would urge you to do a green vote. This just lets them make that decision. Thank you.
Any further discussion? Seeing no further discussion, the clerk will take the roll on the bill.
Looks like we're at 5.
The clerk will close the roll. Russo votes aye. There being 92 ayes and 34 nays, the bill is passed and its title agreed to. The next bill on the calendar for today is House File 385. The clerk will report the bill.
House File number 385, number 4 on the calendar for the day, an act relating to business organizations.
The member from Hennepin, Representative Hortman, to explain your bill.
Thank you, Mr. Speaker and members. This is a bill concerning limited liability corporations. In 2014, we unanimously updated our limited liability corporation statute. We provided a delayed effective date, so the new limited liability corporation statute goes into effect this August. And this is a cleanup bill drafted by the state's business law attorneys to make sure that the new LLC structure works well with our existing law.
There is an amendment at the desk. The clerk will report the amendment.
Hortman moves to amend House File number 385, the first engrossment, and the amendment is coded A2.
The member from Hennepin, Representative Hortman, to explain your amendment.
Thank you, Mr. Speaker. Members, this is just a match up with the Senate, and it simply clarifies that we don't need an organizer or incorporator to be named on the articles of organization or incorporation for a converted entity, and it provides that the Secretary of State will issue a certificate of conversion in these cases. I'd ask for your support on the amendment.
The member from Carver, Representative Hoppe.
Thank you, Mr. Speaker. Members and Mr. Speaker, Representative Hortman, thank you for carrying this bill. I appreciate it. It's a good bill. It's a Bar Association bill. Representative Hortman has put a lot of work on this issue last year and this year. I would encourage members to vote green on both the amendment and the final passage of the bill. Thank you.
Any further discussion on the A2 amendment? Seeing no further discussion, all those in favor of adoption of the A2 amendment signify by saying aye. Aye. Those opposed, no. The motion prevails and the amendment is adopted. The member from Hennepin, Representative Hortman, to the bill as amended.
Thank you, Mr. Speaker and members. Just one thing I want to say before we vote on final passage is there's a business lawyer in the state of Minnesota. His name is Gene Hennig. He's a Republican appointee to the Uniform Law Commission. He has served this state with distinction for 6 years as a Uniform Law Commissioner and made improvements to the law in ways that we don't often pay a lot of attention to. He's excellent attorney, and he's done really fantastic work, and he deserves to be recognized and called out for his achievements in the law, and in particular with regard to this issue. So members, I hope you'll support the bill.
Any further discussion on House File 385 as amended? Seeing no further discussion, the clerk will... Oh, I'm sorry. The clerk will give the bill its third reading.
Third reading, House File number 385 as amended.
Third reading. Any further discussion? Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. There being 129 ayes and 0 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day is Senate File 1406. The clerk will report the bill.
Senate File number 1406, number 9 on the calendar for the day, an act relating to state lands.
The member from Anoka, Representative Hackbarth.
Thank you, Mr. Speaker. I have a couple of amendments at the desk, one to insert the House language.
There is an amendment at the desk. The clerk will report the amendment.
Hackbarth is moving to amend Senate File number 1406, the second engrossment, delete everything after the enacting clause, and insert the following language of House File number 1429, the third engrossment. The amendment is coded DEA 1429.
The member from Anoka, Representative Hackbarth, on the motion to insert the House language.
Thank you, Mr. Speaker. That's simply what it does, just inserts the House language.
Any
your support.
Any further discussion on the Hackbarth motion to insert the House language? Seeing no further discussion, all those in favor of the Hackbarth motion signify by saying aye. Those opposed, no. The motion prevails and the amendment is adopted. There is another amendment at the desk. The clerk will report the amendment.
Hackbarth is moving to amend Senate File number 1406, the second engrossment as amended, and the amendment is coded A4.
The member from Anoka, Representative Hackbarth, to explain your amendment.
Thank you, Mr. Speaker and members. This is an amendment that the DNR brought forward. There's a couple of more parcels that need to be added to the bill, and I believe it's in Representative Dill's district and also Representative Daniel's district. Please support the amendment. Thank you.
Discussion on the Hackbarth amendment. Seeing no discussion, all those in favor of adoption of the A4 amendment signify by saying aye. Those opposed, no. The motion prevails and the amendment is adopted. There is another amendment at the desk. The clerk will report the amendment.
Khan moves to amend Senate File number 1406 as amended, and the amendment is coded A6.
The member from Hennepin, Representative Khan, to explain your amendment.
Mr. Speaker and members, this is a simple amendment to give protection to private property rights for landowners. If we adopt this new language into statute, Minnesota will join 22 other states that support private property rights and stronger requirements to obtain clear permission from a landowner who sets traps on someone else's private property. Currently, Minnesota law allows trappers to set traps on private property without the landowner's permission unless it is adequately posted that trespassing is not allowed. And lands that are cropped or grazed or show signs of tillage do not require posting of signs, and trappers must ask permission to enter those lands. So you see, for certain cases, that's already needed, even if it's just fencing for livestock campaigning. However, for other non-posted lands, Minnesota puts the burden on the landowner. If you don't want traps set on your land without your knowledge, you need to post no trespassing signs annually with letters at least 2 inches high every 500 to 1,000 feet. This amendment simply puts the burden on the trapper to reach out to the landowner and obtain permission before setting traps on their land. And Wisconsin has required permission to hunt and trap on someone else's land since 1995. To hunt and trap on private lands in Wisconsin, you simply must get permission from the landowner. This is a very simple thing, and I would hope that we would just adopt it.
Representative Hackbarth, for what purpose do you rise?
Thank you, Mr. Speaker. I rise under a point of order, House Rule 3.21. Motion and resolution must be germane, and I have advice.
State your advice.
Thank you, Mr. Speaker. This amendment is not germane because the amendment amends Minnesota statutes and Minnesota Statute 97B. There's no amending of any statutes in this bill, and particularly Chapter 92. There's it only pertains to Chapter 92 and not 97B.
Representative Kahn.
Mr. Speaker, I have 2 amendments to the amendment, which I think fixes that. I have the A8 amendment and the A7 amendment. So I'm not quite sure how to proceed under these circumstances. I would certainly argue, since we're talking about recreational purposes are defined, trapping is defined as recreational purposes. And we're also talking about access for fishing, and in the definition of recreational purposes, trapping and fishing are separated only by a comma. So that looks like they're pretty germane when they occur together. So I don't know, the advice is, do I get to deal with the 2 amendments to the amendment first, or do I have to deal with the germaneness issue before dealing with those amendments?
Thank you, members. Having reviewed the bill and the amendment, I find the point of order well taken. There are no further amendments at the desk. The clerk will give the bill its 3rd reading.
3rd reading, Senate File Number 1406, as amended.
3rd reading. Representative Hackbarth to the bill as amended.
Thank you, Mr. Speaker and members. This is the traditional non-controversial lands bill from the Department of Natural Resources. I would urge a green vote. Representative Dill did a great job of authoring this bill and chairing the Land Subcommittee. Please vote green.
Further discussion on the bill as amended. Seeing no further discussion on the bill as amended, the clerk will take the roll. The clerk will close the roll. There being 128 ayes and 0 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for today is House File 1357. The clerk will report the bill.
House File Number 1357, number 7 on the calendar for the day, an act relating to civil law.
The member from Beltrami, Representative Persell, to explain your bill.
Thank you, Mr. Speaker. This bill was brought to me by a constituent, and just after listening to the information that was provided by my constituent, I felt compelled to proceed with drafting a bill to try and right the wrong. And I want to thank co-authors, Representative Scott and Representative Kahn, for their support on this bill. This bill, as if you have it in front of you or maybe not, what it does is it creates a certificate of dissolution in a divorce situation, and traditionally there's a judgment from the courts, sure. And a judgment and decree is issued, and that judgment and decree traditionally has a lot of information in it. Things about children, about assets, Social Security numbers, a lot of information that is pretty personal, and certainly in this day and age can be problematic when the person who's trying to change their name back, as they may be endeavoring to do, is required to produce that dissolution document that has all that information, and if such a thing as changing names on credit cards, and the credit card company says, send me that judgment and decree from the court. So what this bill does is it creates a simple document that removes Social Security numbers from the judgment decree, and it adds any name changes, and it's called a certificate of dissolution, and that everything else there, the marriage date, the date of judgment and decree is all on this certificate of dissolution. So it's a simple document that doesn't have a lot of private information that other folks don't need to see if you're trying to change name on a credit card. So with that, if anybody has any questions about this, it's a good bill. Please vote green.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 1357.
Third reading. Any further discussion on the bill? The member from Anoka, Representative Scott.
Thank you, Mr. Speaker, and thank you, Representative Persell, for bringing this bill. It's a good bill and protects the privacy. I was astonished that Social Security numbers were in some public records there, and so this is a good bill, members. Again, I encourage a green vote.
Further discussion on House File 1357. Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. There being 128 ayes and 0 nays, the bill is passed and its title agreed to. Without objection, we will revert to messages from the Senate. Hearing no objection, messages from the Senate.
Message from the Senate, Mr. Speaker. I hereby announce the passage by the Senate of the following House file, herewith returned as amended by the Senate, in which the amendments of concurrence to the House is respectfully requested. House File Number 283, an act relating to the military. The message is signed by Joanne M. Zoff, Secretary of the Senate. Kreasha moves that the House concur in the Senate amendments to House File Number 283 and that the bill be repassed as amended by the Senate.
I recognize the author, Representative Kreasha, who will explain the Senate amendments.
And thank you, Mr. Speaker. And the change is just simply a grammatical one. The content of the bill is similar, and I would urge a green vote.
Is there any discussion on the Senate amendments? Seeing no discussion, all those in favor of the motion to concur with the Senate amendments say aye. Aye. Those opposed, nay. The motion prevails, and the clerk will give the bill its third reading.
Third reading, House File Number 283, as amended by the Senate.
Third reading, as amended by the Senate. Any further discussion? The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. I wonder if the author would yield.
He will yield. Representative Liebling.
Thank you, Mr. Speaker. I'm just looking at the conference report, and it says on line 1.8, Camp Ripley shall be a sentinel landscape. I don't know if I'm the only member here who doesn't know what that means, but could we just have an explanation of what that is? Thank you.
Representative Kreasha.
And thank you, Mr. Speaker, and thank you, Representative Liebling, for bringing that up. I covered it when we first had the bill come up. The Sentinel Landscape is a new designation that allows us to go out and apply across federal agencies to get new funds in. So if there's more information you'd like that I can provide with you, I'm more than happy to do that.
Any further discussion? Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. There being 129 ayes and 0 nays, the bill is repassed as amended by the Senate and its title agreed to. Representative Garofalo, for what purpose do you rise?
Mr. Speaker, a point of personal privilege.
State your point of personal privilege.
Thank you, Mr. Speaker and members. Earlier this week, we celebrated an important anniversary in Minnesota's history. Representative Murphy having 14,000 days in the legislature. Well, today's members, I also wanted to announce another very important day. Today is the 11,673rd day that Representative Christensen has been alive. So thank you, Representative Christensen.
Report from the Committee on Rules and Legislative Administration.
Pepin for the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Friday, May 8, 2015, and establishes a pre-filing requirement for amendments offered to the following bills. House File Numbers 1187, 2193, 1947, Senate File Numbers 1191 and 462, and House File Numbers 799, 906, 1714, 1792, and 1535. Yep.
Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there's no objection, we'll take action on these motions first. Hearing no objection, the motions prevail. Announcements. Representative Bernardi, for what purpose do you rise?
Thank you, Mr. Speaker. It's an honor to be here today with all of you to reflect and remember, point of personal privilege, by the way, to reflect on the 50th anniversary of the devastating tornadoes that hit the Twin Cities area and actually beyond the Twin Cities in 1965. my community was hit very hard, and actually the resiliency and the faith and the hope of our community lives on in our DNA, and we reflect on it often. I want to have you join us today as we read this House resolution, and I've asked my colleagues in the communities in which the tornadoes hit will join me today. We had four F4 tornadoes that hit the Twin Cities. It said it's been touted as the worst weather impact ever in the state of Minnesota. It's in the Twin City area and the 5th in the state of Minnesota. I also want, before we start this, I also want to invite you tonight to the Fridley High School at 6 p.m. We'll be reflecting and people will be sharing their stories. You're welcome to share your story after this if you'd like to too. There's also the Banfield Arts Center. The Tornado, The Art of Remembering runs through May 16th. And I also want to give recognition to the author Al Taylor, who wrote the books The Night the Sirens Blew and Hidden Revealed, who will be doing a book signing tonight for helping me with this resolution. This is a House resolution on the 15th anniversary of the tornadoes of May 6, 1965. Whereas on May 6, 1965, a swarm of tornadoes struck the western and northern suburbs of Minneapolis and St. Paul between the hours of 5:30 p.m. and 9 p.m., destroying more than 13 lives and injuring more than 683 people. And I'd like to yield to Representative Glenn Gruenhagen.
He will yield. Representative Gruenhagen.
Well, thank you, Mr. Speaker. Whereas the trail of destruction extended from Glencoe to the eastern shores of the St. Croix River on the Minnesota-Wisconsin border, and I'd like to yield to Representative Carolyn Lane.
She will yield. Representative Lane.
Thank you, Mr. Speaker. Whereas the total property damage exceeded $1.2 billion, with hundreds of homes and businesses destroyed and thousands of homes heavily damaged, and Mr. Speaker, I'd like to yield to Representative Yaruso.
She will yield. Representative Yaruso.
Whereas this horrific tornado outbreak was preceded by a record-setting winter and spring flooding, causing great human suffering in the state of Minnesota, and I yield to Representative Pugh.
She will yield. Representative Pugh.
Thank you, Mr. Speaker. Whereas the especially hard-hit areas of Lake Minnetonka, Fridley, Spring Lake Park, and Mounds View found courage and strength from their faith and community to rebuild their churches, schools, and homes in a miraculous way. And, Mr. Speaker, I yield to Representative Newton.
He will yield. Representative Newton.
Thank you, Mr. Speaker. Whereas renewed respect of the forces of nature from that outbreak of tornadoes has led to increased awareness and diligence in severe storm weather preparedness in Minnesota, now therefore, and I yield to Representative Bernardi.
Representative Bernardi.
Thank you, Mr. Speaker. Be it resolved by the Committee of Rules and Legislative Administration of the House of Representatives of the State of Minnesota that on the 50th anniversary of these events, it takes this moment to recognize the sacrifices, suffering, and losses of those affected by the worst tornado outbreak in Minnesota history. Dated May 4th, 2015, Speaker Kurt Dowd, Majority Leader Joyce Pepin, and myself, Representative Connie Bernardi. And Mr. Speaker, if you wouldn't mind, I would like to ask for just a brief moment of silence in remembrance of the people lost in this tragedy, as well as all those in the state of Minnesota that are lost to weather events. Thank you.
Members, please rise for a moment of silence. Further announcements. Representative Erickson.
Thank you, Mr. Chair, and members of the Education Innovation Policy Committee. The informational hearing scheduled for tomorrow has been canceled.
Any further announcements? Representative Pepin.
Thank you, Mr. Speaker and members. I move that when the House adjourns today, it adjourns until 10 a.m. Thursday, May 7th, 2015.
Representative Pepin moves that when the House adjourns today, it adjourns until 10 o'clock a.m. Thursday, May 7th, 2015. All those in favor say aye. Those opposed, no. The motion prevails. Representative Pepin.
I move that the House do now adjourn.
Representative Pepin moves that the House do now adjourn. All those in favor say aye. Those opposed, no. The motion prevails, and the House stands adjourned until 10 o'clock a.m. Thursday, May 7th, 2015.